Imagine this. You're petting your sweet, purring cat. They seem calm, healthy, and happy. But then a question creeps into your mind. Can my cat have rabies? Is that even possible? It's a scary thought, but an important one. Rabies is one of the deadliest diseases out there, and it's often misunderstood. Today, we're going to answer this critical question: can cats get rabies? And more importantly, what can you do to protect them and yourself? Let's dive into the facts. Yes, cats can get rabies. Here's the short answer. Yes, cats can absolutely get rabies. In fact, cats are the most commonly reported rabid domestic animals in the United States. More than dogs. That might surprise you, but it's true. Because many cats, especially outdoor cats, come into contact with wild animals, like raccoons, skunks, bats, and foxes, all of which can carry rabies. Even a small scratch or bite from an infected animal can transmit the virus. What is rabies and why is it so dangerous? Rabies is a viral disease that affects the central nervous system. It spreads through saliva, usually from a bite or scratch. Once symptoms appear, rabies is almost always fatal for both animals and humans. There is no cure once the disease has progressed. That's why prevention is everything. Rabies affects the brain and causes symptoms like sudden aggression or unusual behavior, excessive drooling or foaming at the mouth, difficulty swallowing, fear of water, paralysis, seizures, confusion or disorientation. If your cat starts showing any of these signs after a possible exposure, seek veterinary care immediately. How do cats get rabies? The most common way cats get rabies is through bites from infected animals. Outdoor cats are at a higher risk because they may fight or interact with wildlife. But even indoor cats aren't 100% safe. A bat could fly into your home. A raccoon might sneak into the garage. That's why every cat, indoor or outdoor, should be vaccinated. Can rabies be transmitted to humans? Yes, and this is why rabies is taken so seriously. Rabies is a zoonotic disease, meaning it can spread from animals to humans. If a rabid cat bites or scratches you, or if their saliva comes into contact with your eyes, mouth, or broken skin, you could be at risk. But don't panic. If you suspect exposure, go to the doctor immediately. Post-exposure rabies shots can save your life, but only if given before symptoms begin. How to protect your cat from rabies prevention is simple and powerful. Vaccinate your cat. Most states in the U.S. require rabies vaccination by law. It's quick, affordable, and could save their life and yours. Keep your cat indoors or limit outdoor time to supervised play in a secure area. The fewer encounters with wildlife, the lower the risk. Watch for wildlife activity around your home. Secure garbage bins. Avoid feeding stray animals. Don't approach sick or injured wildlife. Stay up to date on booster shots. Rabies vaccines aren't one and done. Your vet will tell you when it's time for the next dose, usually every 1 to 3 years. What to do if you suspect rabies. If your cat gets into a fight with a wild animal or starts acting strangely. 1. Do not touch them with bare hands. 2. Isolate them safely if possible. 3. Call your vet immediately and explain the situation. 4. Follow professional instructions carefully. If you or someone in your family was scratched or bitten, 1. Wash the wound with soap and water. 2. Contact your doctor or emergency services right away. 3. Inform animal control or your local health department. Time matters when it comes to rabies. Why rabies awareness matters. You might think, my cat never goes outside, or they're too gentle to bite anyone. But rabies doesn't care. It only takes one unexpected encounter. And once symptoms appear, there's no turning back. By understanding the risks and taking simple precautions, you're not just protecting your cat. You're protecting your entire family